This presentation will feature Sadie Costello, James Araby, and Matt Bell. Sadie Costello, PhD, is an occupational epidemiologist in environmental health sciences at UC Berkeley's School of Public Health. She's also director of the Targeted Research Training Program at COEH. Dr. Costello earned her PhD from UCLA in 2008 and came to Berkeley for her postdoctoral research and stayed on as a researcher and faculty member. Her academic focus has been to conduct exposure response analysis and identify bias in large occupational cohort studies. She'll be presenting results from the study on behalf of a larger interdisciplinary team and will be joined by leaders from United Food and Commercial Workers Union, or UFCW. Jim Araby is Director of Strategic Campaigns for UFCW Local 5, which is a 30,000 member unit based in the San Francisco Bay Area. Mr. Araby works across Northern California to build political power for UFCW members who work in the grocery, retail drug, cannabis, and agricultural industries. In addition to his political work, Mr. Araby leads UFCW 5's organizing department. He serves on the advisory board at the UC Berkeley Labor Center, is an appointee on California's Interagency Advisory Committee on Apprenticeship, and is a former board chair for CORO Northern California. Before joining UFCW 5, Mr. Araby was the executive director of the UFCW Western States Council, where he helped lead coalitions in California to pass the first in the nation laws on paid sick days, banning plastic bags, worker retention in the grocery industry, and regulating medical cannabis. We'll also be joined by Matt Bell, who's Secretary Treasurer of UFCW 324. He has been with UFCW for 21 years, serving as an organizer and union representative. As Secretary Treasurer, he is involved in negotiations of union contracts and direct advocacy of grocery and retail drug members in Orange County and South LA County. Thank you all so much for joining us today.
Hi, my name is Sadie Costello, and I am here along with Matt Bell and Jim Araby from the UFCW to present results from a survey we did over the summer on the implementation and impact of COVID-19 prevention on the health of unionized grocery store workers. And so this was a project that came together very shortly after the pandemic hit out of a concern among several of us at UC Berkeley, myself, Carissa Harris, and Laura Stock specifically, to address what we saw as a really unmet need among grocery store workers. And Matt and Jim came on board to help us figure out how to understand what the needs were and help us implement the survey. Do you want to say anything before I launch in a little bit more?
I would just say that, we really wanted to take some time to, really understand what our members were facing from a very personal level, not just sort of an anecdotal level. And this study really helped with those interviews and helped shape, I think, our approach, post-survey results. So
I would agree with Jim on that. We hear it day in and day out from our members, but to actually put numbers and surveys to it was extremely beneficial, not only to drive internally how we do things and to understand it, but to advocate for our members at a better level.
Before we continue, we want to state that we have no relevant financial relationships with a commercial interest to disclose. So when we think about worker protection and worker protection in any workplace, but also in grocery stores, one of the first things we think about is protecting workers, and in an infectious disease setting, think about protecting workers from other workers. But of course, grocery stores are a little bit unique in the sense that we would also need to protect workers from customers and customers from workers. And even one more step is that grocery stores are really a community setting. And so there's community to community transmission. This picture now looks so dated, but this is what grocery stores looked like a year ago. And a lot of the implementations that are in place are, of course, to drive what the face of grocery stores look like. So grocery store workers, at least at the beginning of the pandemic, were dubbed the other essential workers. There were medical workers, there were firefighters, and then there were grocery store workers who were the other essential workers. And y'all might remember very clearly that on March 19th, the California Department of Public Health put in a shelter-in-place order, and everyone had to stay home except those who were there to provide the continuity of essential services. And it became very clear in our society what was essential and who got to stay home and who didn't get to stay home. And there were a lot of rules already, or a lot of policies already in place for emergencies in hospitals and among, firefighters and other places, but there's really nothing in place for grocery store workers. And it wasn't until almost a month later that Cal OSHA issued guidelines for grocery stores, and that was a long month. And even though there were, even after the guidelines came out, we, and I'm sure Matt and Jim even more so, heard numerous reports of stores failing to comply. And some stores stepped up early, of course, but some stores failed to comply. And really alarmingly, there was an increased report in aggressive customers and what grocery store workers were having to contend with.
I would just say those things still continue to this day. Is the one thing I would add. From the beginning of the pandemic, even up to now, it's, grocery store workers didn't sign on to be heroes. They signed on to be grocery workers, whereas police and fire did that, and they know what they're getting into. But definitely, grocery workers have been on the front line of this since the beginning.
Yeah, and I would say that in addition to everything that Matt said, that the difference I would say to add on to what Matt said is that these workers aren't used to dealing with the level of stress that was brought into their workplaces. Being a customer service, obviously there's issues related to interacting with customers on a day-to-day basis overall, and all those issues that come in with that. But then you add on, especially in the early stages of this unknown pandemic, where we thought it was being spread from all kinds of different directions, that stress really increased incredibly on our members, along with customers coming to the store, and the conflict that continues to this day, like Matt said, in the stores, but it was really escalated and elevated very politically. We had members, it's reduced now, but we had members that were in getting into fistfights to do mask enforcement, things that they just didn't need to do. I think it really brought to light. I think the other thing that really brought to light is how essential grocery stores are all the time in terms of tying our communities together. It was really elevated during this time, hopefully as we get through this, that we remember that piece of this, as we move forward. Go ahead, Matt.
So UFCW, United Food and Commercial Workers Union, we represent grocery store workers throughout the country. I represent Local 324, which is mainly Orange County and South LA County. Jim represents Local 5, which is in Northern California. Nationwide, we represent 1.3 million grocery workers in meat packing, in the grocery industry, and in food processing. So these have been areas, I think, as we've seen since March, that have been directly impacted at high levels by COVID with infections. Local 324 up to today, we have 2,335 positive cases that have been confirmed, which is 11.75% of our membership. So there's been ebbs and flows, but especially this holiday season, we saw a huge, massive increase in the number of positives that were occurring, and it was difficult to keep up with. But that's who we represent. If Jim wants to add anything, he has.
I think it's interesting just to look at the discrepancy in numbers in terms of the what's facing in Southern California versus Northern California. This has also been sort of the tail of the pandemic in terms of what we face inside the stores. I would say the one other thing is that these numbers really don't reflect the amount of people that can't work right now because they're in the highly vulnerable population. We estimate, it's probably the same amount of numbers of people not working currently because in Local 5, because of they can't, either they have they're highly vulnerable population, whether they're older members or they, have some sort of, they have some sort of other disease that prevents them from actually, being exposed. So, the impact of this was pretty far and wide. We're still wrestling with it every day to figure out how to make sure our members feel as protected as they can as they go into these stores.
Thank you. So we banded together and decided to do a survey. And so one of the first jobs we had at Berkeley when we had this idea that we wanted to do a survey of grocery store workers was to identify a population. And certainly not all grocery store workers are unionized. But we reached out to UFCW in part because Laura Stock at the Labor Occupational Health Program already has a relationship with UFCW, and we were able to quickly identify that we could partner with Jim and Matt and send out a survey to grocery store workers. And so that was our population that we chose to study. We were really looking at what prevention measures were at different levels of the organization. And I'm going to cover some of those, but, we were thinking about, are there physical barriers? Was there additional sick leave? Was there changes in hours or breaks? What was the work culture like? What were customer interactions? What was access to PPE? We really wanted to, from an occupational health standpoint, understand a lot of different factors in the prevention measures. We looked at some of the COVID-19 symptoms, but mental health is what I'm going to concentrate on in our survey today. And then, a little bit uniquely for myself, I'm a little bit more of a traditional academic occupational epidemiologist normally with, big studies and analyses and publishing in journals, et cetera. But the point that we really came together over for this survey was a little different, and that was to collect information that could be used as soon as possible to improve worker conditions. And so it was a much more action advocacy oriented goal, I think probably for UFCW as well, but just trying to figure out what was going on and how could we quickly improve the situation. So we put together a 10-minute anonymous survey, and we pilot tested it on 3 grocery store workers, and the survey came together after lots of conversations. And we sent the survey out to 25,000 grocery store workers, and that's a bit of the breakdown for how many workers were contacted in Northern and Southern California. And they were contacted by text. I believe you all have a text system so they got texted out twice with an electronic link to the survey that they could click on if they wanted. And this survey was sent out on June 14th, I think in Northern California, maybe a little bit later in Southern California. And then we closed it for this analysis in the middle of July. So some people who responded to the survey, so we got, after we cleaned out some egregious missings, we ended up with 1,126 respondents, and you can see that they're mostly female. So 63% of the respondents are female. And if you look at the age distribution is skewed pretty high. And I think this is higher than the age distribution of all the grocery store workers, and it might reflect who was able to or interested in responding to a survey and providing feedback. If you look at the breakdown of the race and ethnicity of the respondents, they are about half white or Caucasian, but then another quarter is Hispanic, and that's we think not bad given that we didn't have the funds. That's the other thing I should mention. This entire project was unfunded. How did I not mention that in the very beginning? This was a volunteer effort on everybody's part. There's one student who had a stipend to help us with some data cleaning over the summer, but everybody else was, trying to fit it in throughout their other obligations. And so one of the things we could not fund was a translation of the survey. So we only sent out the survey in English. And I think, although my understanding is about a quarter of the Northern California grocery store workers might be Hispanic, it's a little higher in Southern California. And if you look at the salary they reported, this is just their reported salary information. You can see it actually is skewed pretty low. So almost half the population makes less than $35,000 a year, which is not a lot in California, and really not a lot if you've got a family or other folks to support. So that's a little lay of the land. Oh, there's a little bit more. So we asked whether people were working at big chain stores or independent stores, and almost all of our respondents were working at really large chain stores. So again, just to reiterate, some things that we were concerned with that we want to go over were what was the worker experience, what were some of the prevention practices, and what were some of how was policy communicated. So one of the first things we asked is what prevention measures were in place regarding customers where they work. And so you can see that this is just a histogram, right? So for example, almost 80% of folks said that there was social distance signage in their store most of the time. So you can see the social distance signage and floor markings are pretty good, but when it comes to where we now understand much more protection is going to come from the workers, it wasn't so great on whether masks were required or whether fewer customers were allowed. And again, this is over the summer, this may have changed, but this was the lay of the land at the time.
I would say it hasn't changed.
No, it's not changed.
Well, All right. This was a summer and it hasn't changed.
Yes, we're still battling.
Okay, thank you. We asked whether workers had access to supplies and equipment, including hand hygiene, surface cleaners, barriers, and again, masks we now understand are the most important. And at the time, there was a bit of a discrepancy whether masks were required and whether masks were provided. And although many places required masks, without providing masks, that could potentially be a problem. We asked a few other organizational questions, whether every other register was used, whether there was pre-shift symptom check or temperature check. Temperature check is fairly easy to do, but maybe not super effective. And then one thing that I think we all really noticed when this came out is that a lot of workers mentioned that they didn't think they had expanded sick leave if they were symptomatic. And I remember that caught your attention.
Yeah.
Remember, Matt?
Yeah, no, and we tried to communicate. Initially, there was expanded sick leave. It was kind of complicated how it rolled out. But generally, most folks, if they were exposed or felt sick because of the governor's order, they were given extra sick time above and beyond. But just to note, as of January 1, that's more or less disappeared because of the way that just doesn't happen anymore. So trying to figure that out with our members has become increasingly more difficult to try to get them sick time because our members work paycheck to paycheck. If you miss time or you don't have time covered, the problem is then people tend to show up sick because they just need to make rent. So that's not only bad for workers, but clearly it's also bad for public health as well.
Yeah.
And I think, in the beginning when we did the survey, there was still a lack of awareness of the issue. I think we did a better job as time went on, but we're back into that spot, like Matt said, as of January 1. How do we continue to move forward on this? A lot of this was done through negotiations at the trust funds too, where we were able to expand the trust fund access to sick time. But we didn't think the pandemic was going to go on for, we're now in year 2 of it, really, if you think about it. And so how do we think through that? And also, I think there's a real important point here to make, which is around the policy discussion related to, expanded paid sick leave at the state level and what the state can do. Currently the governor is not interested in expanding, is continuing to keep expanded sick leave on the table for essential workers. That's going to be a big fight this year. So I just think it's something that we have to do, and how policy considerations are impacted by political ones. We're going to see play out in real time in California, especially related to this, I think, and also the workers' comp issues that will come up.
Yeah.
We asked a lot of questions about how workers felt about working in the pandemic, and here are some highlights. So a lot of workers said that their workload had increased a lot. Some indicated that they felt pressured by management to work more. There was some indication that people felt good about being an essential worker and feeding their community despite all of the stresses that are so real. And then there was a bit of a wash whether managers were showing gratitude. And, I don't think anyone thinks that a manager walking around saying, "Oh, thank you," is not going to help that much. But there are various ways, I suppose, to show gratitude.
Yeah, I think mainly the gratitude is in pay.
Yeah.
Yes.
If people feel that, you can call me a hero, but if you don't treat me like a hero, pay me like a hero, it's really empty words. And that's the battle that we're dealing with right now, trying to institute hazard pay throughout certain municipalities.
Yeah, and I would say, Sadie, I think it'd be interesting to sort of revisit this issue because I think there's fatigue going along with, as well as sort of fatigue and exhaustion with our members is related to the 2 last questions here. I think especially intensely over November, December, the holiday season, where our members were facing increasing crises and lack of reward and appreciation as infections, basically the infection rate doubled over those 2 months. So
that's absolutely right. This is a time stamp, and I think there were a lot of comments about how. When we asked at the end of the survey, is there anything else you would like to tell us? There are plenty of people who told us that they thought it was particularly unfair that they had friends who were working in sort of similar type jobs that weren't considered essential, who were on unemployment at the time. There was that extra bump of $600 and they were able to stay home with their families. And it was unfair that folks in grocery stores were considered essential and not able to do so. And so I can only imagine as time went on, those feelings became more intensified or complicated.
Yeah.
So to get into pay a little bit more, we asked how folks felt supported by their employers. A lot of people actually did think they could stay home if they were symptomatic without fear of job loss. And that contradicts a little bit their confusion about whether there was extended sick leave. And so maybe that was, two different ways of answering the question, or there was a legality that we didn't quite capture quite right. Most people do not think they're being paid fairly for the risks that they were taking. Most people thought employers were following the local orders, and basically people did not feel like employers were doing anything to support their mental health throughout this crisis. So this, of course, is at the center of the current policy considerations for extended hazard pay, which is now considered higher, right? The fight is for $5 an hour. Is that right?
And certain areas it's $5. We just passed it in Long Beach at $4.
Okay, thank you.
Yeah, throughout the Bay, we're pursuing a $5 hazard pay.
Okay. So the concern that we also all of us were really noticed when we did this survey is the level of anxiety, particularly that everyone was reporting. So over 70% reported having felt anxious or nervous or on edge at some point during the past week. And certainly the summer was an anxious time for a lot of people, but it really was a very anxious time for our grocery store workers. And it's been reported in other places in the literature that anxiety and depression were highest among people who are deemed essential workers, and they had even higher anxiety than people who were unemployed. So this is really a very real, I think, finding and concerning all around.
Right. And I would just say that as time has gone by and the numbers have increased, especially the last 2 months, we don't have the data, but I can tell you anecdotally, we've seen an increase in this and the anxiety of our members. Just in testimony, at the Long Beach City Council, one of our members actually broke down in tears, explaining, the fear of just spreading it and bringing it home to her family. So I would say these things have only intensified and gotten worse.
Yeah, I'm sorry to hear that, but I'm not surprised. We asked some about the interactions with customers during COVID. So at the time, again, in the summer, folks indicated that they sort of agreed that customers would sometimes show them gratitude for working during COVID. There was some agreement that interactions with customers had become more negative. And these two, I think, were kind of the most, came to the forefront for me, that workers said it was up to them to enforce COVID-19 prevention measures with customers, even if they were fearful of their response. This goes back to what we talked to at the beginning. These are not people who are trained to really be on the front line enforcing things like politicized mask use. And they don't have the psychiatrist ready for them at the end of a hard day, ready to unpack a really challenging situation. So this is a lot to ask of a grocery store checker. And then people wrote that they agreed that they were more concerned about their safety when interacting with customers since COVID. And I think our intent when we wrote that was their physical safety, but it's possible that some of it was answered as they're, contracting COVID. So either way, this has become a very, very hard job. We asked about how they understood their work and safety culture, or how their work and safety culture was at their grocery store. And, it was a little bit mixed. They thought that some people sort of agree that the health and safety was a high priority where they work, but you can see that doesn't add up to much more than 50% of the total workers. Some folks agreed their employer gave them the tools and supplies they needed. You can sort of see that it's not a huge yes. And then even here where it looks like a big blue spike at I feel free to report health and safety problems where I work, that spike stops at 40%, which means 60% of people did not strongly agree that they were free to report health and safety problems where they work. And I don't know if you want to speak to that. Is that fear of retaliation? Sure. Do you think that's changed over time? What do you think?
I think it's gotten just as intense as it was in the beginning. I do think there is this power dynamic that happens on, in any floor, even with the union, between how you speak up and where you speak up and whether they want to or not. I'd say in the context of, Cal OSHA, who came out with a series of guidelines, through AB 685, which was just passed this year, defining outbreak and access to testing. We're having a real hard time with our employers who really want to limit the definition of what an outbreak is in a grocery store. And I think that, tends to also put some fear into workers around who's reporting what. I'm not saying people withholding, that they have, they could test positive or have the symptoms of having COVID. I think it's a question of holding the employer accountable to what that means. And I still think that's the case, and the employers are really fighting, to keep, the employer is really fighting to keep these stores open for as long as they can, and also not being known as a store that has an outbreak in it. And so that really puts our members in a very hard position when it comes to their own health and safety, vis-a-vis, interaction with management. So I would see this level, maybe even, again, anecdotally, these last 2 months have been even more intense than the first 2 months of the outbreak in March and April.
So one thing that I wanted to point out was we asked people about how their employer would respond if there was a COVID case, and a lot of people did not think that they would be notified. I didn't have my little circle fly in, I'm sorry. That if a coworker got sick with COVID-19, they didn't think their employer would notify them. So that's, 65% of people were not sure that that would happen. And I know there's been some policies changed around that, and you just talked about it, but it is, that's the reality. And then whether the employer would shut down the store for a deep clean, whatever deep clean means, and whether there would be testing. And so possibly these numbers have changed now. We have a lot more testing availability now than we did, at the time.
I don't know, Matt, you should probably give a little context of Southern California. On these issues, I don't think this has changed that much. If anything, the fight has become more intense.
I would say it has. The notifications, because it's been embedded basically now, they just put a note up on the wall in the break room if there is one, rather than before they were actually telling employees. But because we're so far down, that's what they're doing now. And the testing is really sparse. So it's really up to, it's our employees, our members actually have some insurance, at least most of them do, so they can get tested, but it's usually on their own that they're getting tested.
I would say that, I would say at least in Northern California, we do, to call it specifically, we have one employer who has been very, very cooperative on this issue, and that's been Lucky Save Mart. They have been very, very aggressive, to make sure that there's, that they follow these policy and guidelines, and even overextends the wrong word, but sort of overreact to make sure that, the health and safety of the workers are put together. And again, I think on the union's part of the reason why we're trying to get clarity related to the last policy when it talks about outbreak is because under that 685 definition, if there are 3 more people that test positive within a 14-day period in a workplace, then the employer has to make a testing available to all employees in that store. And so that's really the crux of the fight, and in a grocery store, they're trying to say a department is a workplace, not the whole store. And what we're trying to say is the whole store is a workplace because there's interaction between departments. And so that's the big fight. And that's something that we've been trying to call on the administration to help define, so that employers understand that when 3 or more people have, test positive, that they need to make this available to everybody.
Well, absolutely.
Yeah, we've been saying that COVID doesn't stay in the produce department. If somebody gets sick, it spreads throughout the store.
Okay, so I think the last point I wanted to make here was about how workers got information, and you've already alluded to the fact that a positive case would just be posted in the break room. And so this is, what we asked at the time was, does your employer have a written policy to protect you from exposure to COVID? And I expect every single one of the stores did probably have to have one at the time we sent this out. And most people knew that they had one, but not everybody. And then we asked how they got any training or explanation. And a lot of people said that the information was posted, as opposed to, any other way that one can provide training. Then the next question we asked was how useful was each kind of training type? And so, to the surprise of probably no one who's involved in employee training, in-person individual, meetings are the most effective, followed by online training, and posting information is sort of the least effective way of really getting information out, although it is, cost effective. And so if you look here at how workers are getting or receiving information versus the most effective way to receive information, we can see that although the policies on paper may be, I don't know if they're fine, regardless of what the policies on paper are, the communication to the workers, at least when we sent out the survey, seemed like there was some room for improvement.
That still exists.
Lastly, I wanted to talk about what our involvement was. Y'all have done so much more, so I don't know if you want to take out more, but we were able to write up some of these results and send some of our understanding of what the experiences were in grocery stores to legislators, and relevant to 3 bills. And one of these bills passed, and that's requiring employers to notify employees and to report cases to CDPH, which will have a database. And that was supposed to start January 1st. I'm wondering, and then I think the other bills didn't pass, but a lot of the issues that were embedded in those bills sort of got spread around in a couple of different ways. That's my understanding. I'm not too sure if either one of you can speak briefly about it more.
No, that's correct. It's just it's been, some of that has spread through, but it's not the key thing is enforcement on all of these issues, and that's where things have been lacking. Even when you pass a bill, the enforcement of it is key, and that's the fight that we've been engaged in, along with obviously trying to get more sick leave, but to engage in getting things enforced and enforced properly.
Absolutely. If you only have one enforcement officer per, thousands of employers, it's going to be hard.
Right.
I will say I agree with everything that Matt said. And I will say that Cal OSHA itself has been very helpful in engagement with us and trying to do strategic enforcement, given the lack of resources is really important. I think I think we got to do more of that. And I think the fines have to be heavier, for lack of compliance. And then I think you'll start seeing more, I'll give you a perfect example. I won't name the employer, but we had one employer who was reporting cases to us prior to 685 passing, just reporting the amount of cases. And then we had multiple employers starting to do it as of January 1 when the law was, put in. But then it became this fight around, like I said earlier, the definition of an outbreak and what that means. And so I think to Cal OSHA's credit, they have been willing to sort of partner with us on hearing more about the cases and figuring out where strategic enforcement would take place. But again, I think it's like one thing to take away from all of this. And I think people that watch this is to think about, okay, it's one thing to pass a policy and get it signed into legislation. It's a whole other thing to actually do the enforcement of the law. And I think that's the other side of the coin when we think about passing policies is not only what type of policy we pass, but how we actually enforce it and make it real, and make it sort of put the 4 corners on as much as we can so there are less holes around it.
Thank you. Yeah. So this is my last slide. We had one student who helped us with some data cleaning, Dr. Pacini, who was supported on a grant. The rest of us were fitting it in between other stuff, but it was so important. And I really want to thank Matt and Jim, not only for being here today, but for engaging on this all the way through. It has been a great experience for me as an academic to see a little bit more direct, as action happening sort of more quickly, and I think all of us feel that we really want to help grocery store workers, help make it be better and safer for them, and certainly hope that this partnership and effort moved the ball along a little bit in that direction.
Yeah, I just want to thank you real quick because we deal with things very, very fast. It's almost like putting out fires, and to have actual data is extremely helpful when talking to decision makers, whether it be with the employers or legislators, because we can give stories, but to have the data to back it up and to be able to get it so quickly has been extremely helpful. So thank you for that.